Hi, my name is Nick Tan. I am a first-year cardiology fellow at the Mayo Clinic, and I have here with me Dr. Barry Greenberg, who is a distinguished professor of medicine at UCSD. And he's here today to talk to us about a sub-analysis of the Commander HF study, namely looking at thrombotic events in patients with heart failure, coronary disease, and sinus rhythm. So, Dr. Greenberg, do you mind sharing your thoughts on the analysis and telling us what you think the clinical implications might be from this?
Thanks very much, Nick. So this analysis was based on the Commander HF study, which, as everybody probably knows, was published back in the New England in October of this year. And those results for the main trial showed that in this patient population, which is characterized by individuals with reduced ejection fraction, but an episode of recent worsening, that when low-dose Rivaroxaban was started, there was no significant effect on the composite of mortality, MI, and stroke. However, when we look closely at the data, we noticed that this was driven largely by mortality, and many of the deaths were related to pump failure. And then when we looked at the other two components, that is the MI and stroke, what we found was there appeared to be some difference in the hazard ratios. And when we actually tested this, there was a suggestion that there was a difference. So we decided to go back and use the Commander database and do a post-hoc analysis where we looked at a composite thromboembolic endpoint. And this was composed of MI, ischemic stroke, sudden or unwitnessed death. And the reason we included those individuals is there is information in the medical literature that many of these events may have a thrombotic etiology, and then deep venous thrombosis and pulmonary embolus. And all of these events had been predefined in the study manual, and there were very specific criteria for each, and they were verified in the context of the trial. So that then became the composite that we looked at, and what we found was that in contrast to what was seen for the primary result for this post-hoc composite, there was a 17% risk reduction with Rivaroxaban compared to placebo, and this was statistically significant in favor of the Rivaroxaban patients. The clinical implications of this, I think, are severalfold. One is, I think it gives us some important insights into understanding Commander. And the study was initially designed to assess whether or not giving Rivaroxaban, which was an antithrombin activation drug, whether or not this would improve outcomes in patients that had worsening heart failure. In other words, a high-risk heart failure population. It turns out that it didn't, and what we know now is that thrombotic events are not drivers of mortality in this population, nor of recurrent heart failure hospitalization. However, the data also shows us that this population, which was identified as having atherosclerotic disease because everybody had to have coronary disease to get into the trial, that in this population there are ongoing thromboembolic events, and that low-dose Rivaroxaban appears to favorably affect them. The important clinical implication is that in stable atherosclerotic disease, low-dose Rivaroxaban has now been approved based on the results of the COMPASS study. And what we show is that in patients with coronary disease, with heart failure and reduced ejection fraction, even though we don't affect the acute outcome, over time we're seeing an accrual of thromboembolic events, and that Rivaroxaban has an effect in reducing the risk of these events. What that means then, I think, clinically to us is that if patients are being considered as a candidate for low-dose Rivaroxaban based on the presence of either coronary disease or peripheral vascular disease, that having heart failure would not be a contraindication. The primary indication would be the coronary disease, and you basically see the same background event, thromboembolic event risk going on in this population. I think that's an important insight.
Thank you very much for sharing your thoughts with us regarding this important topic. For more videos like this, please visit our channel at youtube.com/fitsonago. Thank you again.